Present. Okay, so I'm just going to wait for a few more students to come and we can get started. We have people joining us. Okay, so welcome everybody to the virtual dental shadowers session. We have Dr. Gresham today, who's going to be discussing her journey and everything that happened on her pathway to dental school. So just to remind you that we do have a quiz at the end of the session that'll be up for 24 hours, and it'll be on our link tree on our Instagram page, and you can get all of the information on there. And so I'm just going to pass the mic over to Dr. Gresham. So whenever you're ready, you can start.
Hello, everyone. My name is Dr. Gresham. I'm a dentist in Boston, and I'm really happy you guys have me tonight. Thank you so much. And if there's any questions, feel free to ask. I'm, here to kind of help you. So whatever I'm not talking about, you want me to talk about, feel free to jump in. So background info is my name's Khara. I'm from Philadelphia, and I came to Boston for dental school. Originally, I wanted to stay in Philadelphia, but Tufts is a really good dental school, so obviously I chose to go there. I went to undergrad at Brown. I knew from pretty early on that I wanted to be a dentist. I shadowed my dad's friend who was a dentist when I was a first year in college, and he let me be really hands-on. It was actually more of a summer job versus a shadowing experience, but he told people that I was in school. He didn't tell them that it was not dental school and that it was just college, but I was his assistant, and sometimes he would let me clean teeth, which I'm fairly certain is illegal, but I had a really good experience doing it. And just the lifestyle that he lived, how he interacted with patients, how his day was different every day, and how he was kind of, the only person in charge at the office. Like, it ran the way he wanted to run. He didn't really have to answer to anyone. I really kind of appreciated that aspect of dentistry. So when I went back to school, I was like, this is what I'm doing. Originally, I was going to be pre-med, so I changed to pre-dental and kind of went from there. While in college, I did a bunch of community service and just made sure to take kind of the prerequisite classes. But I would just say that you don't have to take the pre-med or pre-dental classes if you want to go into dental school. You're welcome to kind of major in whatever you want, as long as some way along there you get those courses in, or if you do a post-bac or something like that after college, if you know that you want to major in something else. Kind of just make sure you're enjoying your college time. Don't be so focused on getting to dental school, because it'll definitely be there. I did choose to be pre-dental because science was kind of my thing, so it just made sense. Got into Tufts, went to Tufts, and have stayed in Boston since. I work in two offices. One is kind of right in the heart of downtown Boston. It's a cosmetic dental office, and I love it. And then the other office is a little bit outside of Boston, and it's more of just a regular general dentist office. We do cosmetic work there, and I place implants and kind of do the whole gamut. But it's a more like low key setting versus the office in Boston. That's more it's a little bit more higher end. Sorry. So study tips for staying motivated, I would say. For me, it was helpful to have a really good study group, especially people who were like-minded, were in a similar career track as me. And so I would have kind of a group of people to bounce ideas off of and keep me on track. But it was also kind of a double-edged sword because it's easy to get distracted when you're studying with your friends. So you want to make sure there's like good balance there. So for me, that was the best way. I'd also just say kind of learn what your studying style is and stay focused on that. So for me, I know that I have to go through everything once by myself before I go to the study group. So I kind of have like a base idea of what's going on. So don't try to study how someone else studies because it might not work for you and you could kind of fall down the wrong hole there. So learn what works for you, stick with that, and try to learn it as early on as you can. I would also just say, like, breathe. Again, undergrad is meant to be enjoyed. So as much as you want to stay focused and, study for the DAT and get into a good dental school, it's also, your time to enjoy. So don't get so kind of narrow-minded that you're losing track of the bigger picture and the bigger picture of what life is. So I think for me, I sometimes would just get so stressed out that I wasn't enjoying myself. So make sure you don't do that. Same thing from once you get to dental school, I would kind of just recommend the same things. And I would also say learn how to study while you're in undergrad because it doesn't get any easier in dental school. And if you haven't already developed like good study habits, it's easy to get lost with all the requirements and coursework that dental school requires. Tips for staying motivated. I would just say have a really good support system, find your good group of friends and family members who you can kind of lean on when you're having a tough time because it's always going to be hard. Once you get to dental school, it doesn't get any easier. So also I'd say take breaks, find a good balance. It's really easy, again, to get wrapped up in being like the best student and, hitting all the goals and milestones that you have set for yourself. If you're like me, I always have like a goal that I'm reaching for, striving for, but not to like put your blinders up and enjoy life around you. Because you don't want to get to the point where you're burnt out or losing interest in the profession, which I've seen many of my friends do because they've been so just so over focused. So find good balance. The community service I participated in, I did a bunch of different things. I was in this program called Best Buddies. I ran, so we did a lot of like local, like running charities and like developing those. I would just say don't do it just to do it. Find something that you're really interested in doing. So it doesn't feel like a chore. You're just kind of trying to reach those hours that you have to do. But you want it to be something positive that you look forward to and are having fun and that you could kind of carry on long term if that makes sense. So for me, I really enjoy mentorship. So through Tufts, there's a lot of different programs that we could participate in post graduating. So there's a program called the Sherwood Project. It is a student-run dental clinic, so it's medical and dental. The students completely run it. I'm there just like kind of as a faculty advisor or a mentor. They see patients, they do exams, they do screenings, they can place fluoride once they're at a certain class level. So it's really nice to kind of guide students through that that aspect of dentistry, and I love doing it. I don't ever look at it like, oh, I have to go there. It's something that I really like doing. So I just like kind of have that mindset when you look at community service in general. Choosing specialty. So I'm actually not a specialist. I'm a general dentist. And cosmetic dentistry is not its own specialty. It's just kind of a different subset of general dentistry. But when I was in dental school and even before, when I was trying to figure out like what kind of dentist I wanted to be, I just tried to narrow down what I liked and what I didn't like so that I could make a decision of what to specialize in, or ultimately I made the decision to not specialize. And I didn't specialize because I wanted to be able to practice a variety of different like like aspects of dentistry. So I really like cosmetic dentistry. I like surgery, so I really like extractions and placing implants. And obviously, I like basic, like bread and butter dentistry. So I didn't want to be limited because once you specialize, like if you're an orthodontist, you're only doing braces. If you are a prosthodontist, like you can't really do other aspects of dentistry. If you're a periodontist, you're kind of doing that. And I didn't ever, I know myself, and I wasn't going to be able to just do one thing for the rest of my career. So general dentistry, you're able to either do like a general practice residency if you want to learn more, or you can just take CE. So that's what I've done ever since graduating. Excuse me. And just taking as much CE as I can in the aspects of dentistry that I'm really interested in, and I've felt that I've able to kind of master. I wouldn't say master. You're always learning, but I'm able to learn the different things that I want to and implement them in my daily life. And the kind of impact I wanted to have in my community wasn't really just to be a specialist. It was to be able to kind of bring a patient in and kind of meet them where they are and be able to provide all the services for them from start to finish. And I'm able to do that through general dentistry. It was difficult to kind of come to that conclusion. I really had to like kind of think about it. So I would just recommend, if you're thinking about specializing, think about why. If you're just doing it for money, or if you're doing it for because your parent or somebody is a specialist and they like it, I would just try to make the right decision for you, and that you like it. And you can always like switch specialty. I have a friend who's now going back to being a surgeon, like a few years after graduating dental school. So you can always go back, but it's a harder process. So just make sure you're kind of really focusing on it and narrowing down what you want. The specialties that I was considering were prosthodontics and periodontics because I wanted to do more cosmetic work, and I did want to be able to place implants and do a little bit more surgery. But I liked I think I would just recommend being intentional with what you want, so you can kind of curate the type of career you want, because you want to enjoy it. You want to enjoy it long term. You don't want to wake up one day and hate dentistry. So just being intentional when you're in college and in dental school about where you want your actual career to go versus just kind of following the path that everyone else is doing. A typical day for me, in both offices, we do pretty similar dentistry. It's just like the pace is different. So one office we see a lot more patients. The other one is very like it's slower pace, but we're doing bigger cases. So we come in, we have a team huddle. We review the cases for the day, make sure that we have everything that we need, and then we seat our first patient. Most patient concerns kind of at both offices are their pain or that they don't like the way their teeth look. So for me, the biggest challenge with that is figuring out what they really mean when they say, I don't like the way my teeth look, because it's usually, sometimes it is just like, oh, this one tooth here is bothering me. But usually it's like a emotional thing where they weren't able to have care when they were younger and they now want to fix it, or maybe they're getting married, so now they want to change their smile, they want whitening, they want veneers, whatever the case may be, really getting to the root of that. So I am giving them the care that they want versus what I think, because it's easy for me to develop a treatment plan. I can always, find problems and want to fix them, but what might be the biggest problem for me that's going on in their mouth might not be what they see and what they want done first. So meshing or coming up with a treatment plan that meshes what the patient really wants and what is clinically and like ethically needed is kind of the hardest part, because sometimes they're not the same thing. The toughest parts for presenting treatment plan for me are cost. Dentistry is expensive, and it's only getting more expensive, and insurance is getting worse, and that's kind of one of the biggest challenges of dentistry right now, is dealing with insurance companies and their lowering reimbursement rates. So sometimes cost can be a deterrent for people, or they might get sticker shock. So I've found that the more upfront you are with patients about costs, the less awkward it's going to be. When I first started, I was really awkward talking about money. I didn't, want to assume that someone could afford or not afford something, and it would like make me really uncomfortable to have that conversation. And I would really honestly just punt it off to my front desk. But that kind of left. There was a lot kind of. It was easy to let the patient walk out the door, and then they would never have treatment. So I found is for me, it's just, get the awkwardness out of the way. Just tell the patient, don't have to be specific with exact numbers, but tell them it's going to be, you know, hundreds of dollars or thousands of dollars or X amount. And just, letting them know, like, I understand that it's expensive, but this is the cost for, the treatment that you need. And, we'll work with you to get it done. And I've had to learn to kind of value dentistry as much as I value the patient's feelings, because at the beginning I was more concerned with how they feel about getting a high cost versus knowing that the value of dentistry is for them. So just having that mindset, I think, made much easier. Another part that has been difficult about presenting treatment is sometimes patients feel very overwhelmed. Sometimes they have a lot of work that they need to do, and it's hard for them to wrap their head around it. And again, I found the best way for me to deal with that is just to take feelings out of it. And, I give them facts. I talk to them in clear language. I try not to put a whole bunch of dental jargon in so they're not confused. And just let them know, if this is a problem, if you were my mom, this is what I'd recommend for her to get it fixed. So this is what I'm recommending to you. And then at that point, you just kind of leave the decision to them. It's kind of in their hands. They have all the information. The other thing that's tough is time. Sometimes patients come in and they think dentistry is a magic wand, and that, like, fix my teeth and that it should be done by next week because my wedding is, in 2 weeks. And that's not how it works. So just giving people realistic expectations about time and what's practical, and to be able to do the best work that I can do the time that I need. So that, we're not feeling rushed, and that, we're also valuing the patient's time, because you also don't want to drag something out, over a long period of time as well. So I typically in a day see anywhere from like 7 to 10 or 12 patients, depending on the office. One office is a little bit busier, so we see like around 12. The other is, like I said, slower. So it's usually around like 7 or 8. It's, regular 8 to 5 schedules. We don't have Fridays are half day. So it's, it's a pretty nice dental schedule. I do work one Saturday a month, so it's not bad, but, I've been able to kind of over time arrange my schedule how I like it. So I would also be intentional with that whenever you get into the profession. So you're not feeling overworked or not working enough. So again, you're getting out of dentistry what you want. You spend a lot of time in school. It's a lot of money. It's a very expensive career to go into. So you want to make sure that you're happy with how you're practicing after. And then we just have some cases. So this is the patient, one of my favorite patients. She's like the sweetest person ever. But she originally came to us with, a lot of worn dentition. She was always chipping her front teeth, and she didn't like the color. She didn't like how they looked. So and she had some missing teeth as well. So we had already done an implant and restored it on her. And that's kind of when she was like, oh, okay, now I want to start fixing my other things. So far we've done some veneers and crowns on the top teeth in this photo. Since the photo was taken, we've, on her lower right, done a bridge. So we've closed the space. There's no longer a missing tooth. And we were able to kind of open her bite so that she's not chipping her teeth as much. And we placed on the lower left an implant that's healing. So she'll come back in a couple months to get it restored, and then she'll be done, which has been awesome. I've been seeing her for about 2-3 years, so we kind of phase stuff out for her. And she's, she loves it. She's really happy. And like I said, she's like one of the sweetest patients. So I just try to work with the patients, not try to overwhelm them, and meet them where they are, in terms of finances. Like, we can always face the things in order to get the result that patients need and want. This is a patient where she had acid reflux. She had a lot of staining. She had a lot of like erosion on the backs of her teeth, and she had a bunch of fillings, like just composite buildups on her front teeth to restore that. And she didn't like how it looked. Obviously, also she has some missing teeth. She thought that they were uneven, so we wanted to crown and veneer the front teeth, all 6 of them. But she wanted to only do the front 4 due to finances. So that's one difficulty that we do run into when the patient can't or won't accept the full treatment plan. But, we, again, try to work with them and meet them where they are. Then this is the day of the crown insert, so she loved them, and now she's now like, oh, I see what you mean. So um, she's getting a bridge in the upper right to replace the partial that's there, and then a bridge on the lower left. So we'll actually complete her treatment. So um, sometimes it just takes doing some of the work for patients to see what's possible, because sometimes they can't see the finished kind of goal in their mind. So once you start it, then they're like, oh, okay. And they'll be more willing to continue on with treatment. And this is an implant bridge that we placed. Our patient, she has cancer. She's been on chemo radiation, so she has a lot of dry mouth. And when someone has dry mouth, they don't have any saliva, which is protective, and the enzymes in saliva help to kind of combat bacteria and keep us from getting decay. So if you don't have a lot of saliva, which happens a lot when you're on medications and we have chemo and radiation, you tend to get a lot of decay. So even though she comes, she's like perfect with her hygiene exam. She comes every 4 months. She just has lost some teeth over time to like decay that has progressed very, very quickly during the course of her treatment. She wanted back teeth and to be able to chew. Because she's had so much chemo and radiation, the quality of her bone wasn't ideal. So getting the implants placed somewhere where we knew would be stable was the biggest challenge to her treatment. We were able to, so the implants are in with the healing abutments in the upper left picture, and then she came back after a few months of healing, and we put the abutments in, and then the crown's on top. So now she has posterior teeth on that side. We did ideally on the other side want to put another implant with so she could have like another molar, but her bone, like her sinus is too low, and she had a lot of bone defects there, so it just didn't really work out. But it's, the patient is very, very happy. She can chew. She doesn't feel like she's gonna crack her veneers and crowns that she has in the front teeth. So she's happy. We're happy, and it's kind of a good situation. So that's my favorite part of dentistry is, it's not always perfect, but getting the patient, comfortable and a result that both of us are happy with.
Okay, great. Well, thank you so much for sharing your story. I can definitely tell that you're really passionate about this field, and I know that so many students are going to be inspired by you. So let's get with the questions. Again, there is going to be a quiz after this session that'll be up for 24 hours, and you can get that through the link in the description or in our link tree on our Instagram. So one of the questions we have here is cosmetic dentistry its own specialty / residency option, or is it something a general dentist can mainly focus on?
It's definitely something a general dentist can mainly focus on. It's not its own specialty. So there's 9 ADA recognized specialties, and it's not one of them. So, but you can do like cosmetic fellowships. So Tufts had, I think they called it an aesthetics fellowship. So it's not, you wouldn't have like a certificate like you would from a residency program, but you would, have it on your resume that you did a fellowship. Sorry, in aesthetic dentistry. And I'm sure plenty of other schools offer the same thing, but you are still a general dentist. You're not a specialist once you've gone through the program. It's kind of just like advanced studying. So general dentist, that's one option they can do, or you can just take CE. So I've taken, there's a cosmetic dentist that is in San Diego that he didn't go to Tufts, but he's really good friends with one of Boston's kind of like top dentists who's a Tufts professor. And anytime he has a course, I take it. And you're not going to learn everything in a year or a month or a day or anything like that. But over the years, you just kind of develop things to put in your toolbox and keep using. So it's definitely something that a general dentist can focus on. That's mostly how people do it.
Okay, the next question we have here is there something you wish you've done differently in dental school?
Something I wish I had done differently in dental school. You could always like learn more. Like I look back and there's stuff that I'm like, oh, I know we learned this and I just can't remember it. So like I wish I could remember everything that I learned. It's just easy to get overwhelmed in dental school because they're throwing a lot at you. So there's topics, especially like the first year of didactics. It's like they're teaching you occlusion, and you've never seen teeth inside someone's mouth. Like you've never actually seen teeth come together. So it's hard to, for me at least, it was hard to understand truly what occlusion meant until after I'd started seeing patients. So you know, I don't know that that's something I could have changed. I think maybe if they changed how the curriculum was set up, it would have been different. But I think I wish I learned more. He is expensive, so it's stuff that you're like, oh, if I paid more attention to those, I wouldn't have to pay for this right now. But you kind of you can't learn it all in, like I said, in one day. So, and they know that at school, so they give you a lot of information, but they're like, but continue. You're always learning. That's something about dentistry. You always are learning. So never, I would just say, never get out of dental school and not keep taking CE, and because you kind of like stuff changes all the time too. So stuff that I learned in school 3 years ago is not what they're teaching anymore. So you always want to kind of stay abreast of new things.
So, would you say that the work of a dentist on a daily basis is very strenuous compared to the other fields?
Oh, like other medical fields? Yes and no. Like we sit all day in like kind of an awkward angled position, so it's strenuous on your back. Like my back has pain now, and I'm like, why? But in terms of like actual physical labor, I don't think it's that strenuous. Like I'm not sweating. I don't feel like exhausted at the end of the day at all. But I know I have to be like cognizant of how I sit. Like I try to sit up straight and not like tilt my neck over, so I don't end up, there's always a dental professor whose neck is like stuck in this awkward position. So I try to make sure that I'm like stretching and doing stuff like that, so I don't end up that way. But it's not necessarily strenuous. It's just that's not how your back is supposed to be.
So, the next question is, what is something that you struggled in dental school?
Um, like I just the amount of work. I don't think there was any one thing that was like the hardest thing. It's just a lot of work, and you have to have good time management, which is not my strong suit. I'm easily distracted, and I want to do everything. So having to realize that like I'm not going to be able to do it all is was the hardest thing. So because I also did my MPH when I was in dental school, I did a dual degree DMD MPH, so it was just like hard to manage everything, and so I struggled like having a life and doing all of that. It's definitely doable. I did it. It's fine. I'm not gonna lie. It wasn't horrible, but like I just had to like be very cognizant of my time management.
Right. So, was there like a fun experience that you had in dental school that you could tell us about?
I learned how to ski in dental school. I'd never had skied before, and like for whatever reason, all of my classes essentially had like gone to Colorado in their gap year and become ski instructors. So we freshman year we started an annual ski trip, and that was like the best, the highlight of dental schools. Learning how to ski and then going every year, and then now after dental school, going with the same people. Like obviously not every year, and this year definitely didn't happen, but meeting up with them and going skiing.
That sounds really exciting to learn that. Um, my Another question that we have here is, have you ever had kind of like a difficult case or a patient that you could tell us about?
Um, there's always a difficult patient.
Right.
The dentistry, I would just say, is never really that hard. Like, there's always a solution dentistry, and I would just say, like, make sure you have a network of dentists, classmates, whoever that you can reach out with to even after dental school, and like just kind of talk about cases and how you would treat them. I've got my mentors from dental school and a group chat of my girlfriends from dental school, and we are always like, "What would you do here? How would you do this differently?" So it's never really the dentistry that's the most challenging, but like managing patient expectations, managing patients' attitudes. Sometimes patients are just like mean for no reason, but you have to realize that it's like a very personal and sometimes intimate thing to have your fingers in someone's mouth. And for some people, like for us, we do it every day. We do it 10 times a day. It's completely normal. But for them, like it's hard to have someone sticking their hands in their mouth and telling them that they're, not brushing their teeth well, or like the reason they have to pay me $10,000 is because they didn't, do something last year. So just being cognizant of how you talk to people and try not to like shame them, and then also, but like managing their expectation, telling them what's possible and not possible. Like I think that's the most challenging part. So it's not like there's no one patient. There's like a patient every day who's like that.
Right.
You have to kind of really talk to them in a certain way.
Right. Okay. So another question we have here is I'm worried about not having good manual dexterity skills. How do you suggest I improve this? So what have you done to improve your manual dexterity skills as well?
So before dental school, there's not really much you can do. I mean, you can't really like teach yourself what you don't know. But in dental school, for sure, I just practiced as much as I could. So in pre-clin, when we were just learning how to cut teeth, I bought like hundreds of the blocks that they gave us, hundreds of extra teeth, and I would just go, excuse me, after and just like keep cutting and keep learning, because the more you do it, the more you learn. And the better you get. And even to this day, like I'm much better now at crown preps, and I do them much, much faster than I did when I was in dental school, obviously. And then even from like 2 years ago, just by repetition. So unfortunately, there's no like, shortcut to it. You just have to like practice as much as you can.
Right. And I know that it's really difficult for students to practice their manual dexterity because
Mhm.
doing something compared to being in the sim lab is totally different than, sewing or playing the piano, right?
Right.
Um, so we're gonna start wrapping it up. So we have a few more questions here. Um, so I believe you touched upon this, but what is your favorite procedure to do?
Ooh, my favorite is right now implants. I've kind of been just trying to do as many as I can, but I like implants, crown preps, and it's not really a procedure, but Invisalign. It's like really not that hard to do, but the results are awesome, and patients are like,
Right.
like the Invisalign patients are always the happy patients. You don't really get upset at Invisalign patient. There's not a lot of pain. Like the pain is, it's expected. You're putting a tray in every day. That's going to
Yeah.
kind of hurt, but there's no shots involved. Everyone's pretty happy. So
Okay. So
How many hours do you
let's see
recommend?
right here. Um, so overall, what would be your final advice for pre-dental students that are in this stage, especially during COVID? They want to do as much as they can to be, practicing their manual dexterity skills, their applications. What would be like your final advice for them?
I would say focus on the application. And once you get interviews, really focus on the interview, because that's what makes the difference. I was on the interviewing committee, and every student studied really hard. Everyone had good grades, so it was really the interview that set them apart. We Most dental schools don't want a robot. They want someone who can, at the end of the day, have good patient communication skills and work well with their colleagues and kind of be able to communicate with other patients. So that having that shine through in the interview, I think, is the most important thing. So um, going over interview questions, kind of like doing mock interviews with people, I think would be really helpful. Manual dexterity, I didn't do anything to practice manual dexterity before dental school, so I mean, like you said, you could definitely sew, you could take a piano, but I don't. We're all, unless you're an older dental student or older student going to dental school, we're all young, and your fingers are going to be able to do the work. Absolutely, I wouldn't necessarily worry about that too much. And just kind of keep focused, but don't overdo it. Make sure there's a balance. Dentistry is a great career. I would definitely highly it, but it's like a long journey. You don't want to get like burnt out before you even kind of get to the end.
Right. So our last question here is how many hours do you recommend wearing Invisalign every day?
all day. Don't
Right?
keep them out to eat and to drink something that's not cold. If you're drinking cold, like seltzer or water, something like that, you can keep them in all day. I say 22 hours a day to my patients. Like
22 hours, even when you're sleeping,
and brush your
right?
teeth. You all definitely while you're sleeping.
Okay, so thank you so much for coming and doing this session with us. I know you've inspired me. I know so many other pre-dental students are going to be inspired by you. So just wanted to let everybody know there's going to be a quiz after this session. It's going to be in our link tree and the description in this video, and you have 24 hours to do it and get your scores. And that's all for today. Thank you so much again for coming in.
My pleasure.
I appreciate it. And yeah, take care, everybody.